Alzheimer's is the most common form of dementia or memory loss that we see, and it can start off as very mild forms of memory loss and then actually end up being the sixth cause of death in the United States, mainly because people start to forget how to swallow and even perform daily functions. And the #1 risk factor is being greater than the age of 65, and then also having a family history, although genes are not necessarily directly correlated with having the disease.
Okay, I feel like we've learned a lot more about it in recent years. We're talking about a lot of research being done. What are some of the warning signs, and why do we expect this number to go up so drastically in the next 40 years?
Well, the baby boomers are now over the age of 65, and as more and more of them become and kind of are over that age, since we know that age is the greatest risk factor, we're seeing more people develop the disease.
Simply a factor of population.
Factor of population. And so as a result, what we're seeing, more companies trying to figure out, not just try to minimize memory loss, but also what's causing the disease, which is an accumulation of these proteins called amyloid in our brain. And so they've been doing a lot of work to try to not only address it through drugs, but also now with virtual reality. What we do know is that you can start having these plaques develop much earlier than the actual memory loss. And so many scientists believe that by the time you're actually showing the signs of dementia or memory loss, it's almost too far gone, because you've had almost 10 years of this protein buildup in your brain.
So what's the success rate been when it comes to like medication? And then let's talk about virtual reality, how that now factors in.
So the recent drug, Aduhelm, came out, which actually showed that it was able to decrease those plaques in our brain between 60 to 70% after just 18 months of taking the drug. So first drug ever to get this like fast approval by the FDA to actually treat the cause of the disease versus just the symptoms of memory loss.
Was this controversial? Is this the one I'm thinking of, right? Where it was very expensive and kind of was approved quickly?
It was, and then it also had side effects associated with it as well. But it gave a lot of people hope, because it's a very devastating condition, not just for the person that's going through it, but sometimes the family members that have to support the individual. And so that's the reason why we continue to find alternate or adjunct ways to actually treat the condition, maybe with other medications that are more traditional, less expensive, that actually help with the memory loss component of the disease. And so recently there was a study looking at virtual reality, and what they found was that they administered the VR to rats, and what they saw in the brains of those rats is that these electrical waves came over the part of the brain that generally stores your memories, that helps in creating memories, the stories of your life. And those electrical waves changed and became theta waves. Theta waves are waves that run through your brain when you're kind of daydreaming. And so it changed the electrical current of the brain. And so scientists believe that if you can change that electrical wave in the brain of a human, then potentially you can break up chunks of learning materials, whether it's processing a new memory, like, you know, I have an appointment tomorrow with my doctor. If you can process it with this electrical impulse in your brain is able to process it better than the typical theta waves that are utilized when you're learning at a more rapid speed.
So you have this protein that builds up in your brain over a period of time. Is this like an icebreaker, like it's breaking through with these new memories?
So so the plaques still are there, and so that's the reason why Alzheimer's is so complicated, because we believe that it's not just those plaques. There are other components that are contributing to the disease. So if you can potentially trick the brain as to how it's storing memories, then perhaps you'll be able to bypass how you generally store memories and where those plaques generally affect the memories that create Alzheimer's.
So let's talk about the practical implementation of something like this.
Yes.
Is this like a treatment? You come in every week and you play virtual reality. Is there a certain kind of game or activity that works best within VR?
Right. So right now it's experimental. It's on rats. Just like this drug, Aduhelm, we covered this like 5 years ago, and now it just recently got approved. And so it's just to give those that are out there hope that perhaps it's something that they can talk to their doctors, their neurologists about. This is something that they may be able to do at home by putting on one of those VR sets, and you can actually just watch at home, and perhaps it's the way that certain memories are stored in your brain. You can remember them, and you can remember turning off the stove, going to your doctor's appointment, the names of your kids, those types of things that can be extremely frustrating for the experiencer of the disease and those that are around that person.
What's also neat too is 2021 now. I mean, you have those at-home consoles, if you will, the Oculus, for example.
Yes.
That they're a couple $100 and they're not what we used to think was sometime in the future. They're here.
They're here.
Yeah.
And so I think that it's probably a more practical solution for those that are trying to do everything possible to retain those memories.
Okay.
But we know that Alzheimer's, just like cardiovascular disease and cancer, are also a hyperinflammatory disease, right? That's why we see it with age. And so good diet is still one of those things that can bring down inflammation so that you can bring down that protein buildup in your brain. Also exercise, regular exercise, and minimizing your alcohol consumption. All of those things still play a role in minimizing disease.
Okay, giving some hope at least as we move forward that something's in the works. All right, Dr. Fabi, thank you so much.
Thanks for having me,
Appreciate the
Andrew.
insight as always.
Thank you.